Hello, welcome back to Take 10. If you're just joining us, with me today is Dr. Joseph Dello Russo, ophthalmologist. Welcome back to Take 10.
Thank you.
Now, I was thoroughly amazed, first of all, with the cataract surgery, but got blown out of the water when you showed me the surgery for PRK. Let's talk a little bit about that. How long has the actual surgery been around?
The laser vision correction, if you want to use that term, has been around about 10 years now. I've been involved with it for the past 9 years. And I was one of the original researchers who tested and proved the laser for the FDA. So I've been involved right from the beginning.
Are we seeing the same successes as far as recovery time with PRK surgery or procedure that you do with the cataract surgery with the quick recovery times?
They're both great surgeries. Not to confuse you, but there's a term called laser vision correction where we use a laser to reshape the front of the eye, the cornea of the eye, so as to eliminate the need for glasses. Well, the procedure that we developed it on, what it was based on, is called PRK. In the last couple of years, another procedure incorporating the laser has developed as well, along with it. So now we have two procedures. You saw one. You saw what's called PRK. That's a simple procedure. Then another one is that incorporates lasers called LASIK, which is even faster recovery. The next day, you see.
What exactly is it doing? Is it shaping the cornea, or is it?
It's reshaping the front of the eye. And if you're nearsighted, the rays of light are coming to focus. They're being bent too much by the cornea. So reshaping the cornea so as to flatten it a little bit, so as to the light rays will fall properly on the retina. If you're farsighted, it's the opposite situation where your eyes are too weak. We have to make the cornea stronger and reshape it to be stronger.
Now, I guess the misconception or the term normally used is Coke bottle glasses. Now, the patients who come in wearing them, I mean, what is the limit? How much of a person's sight can you correct with this type of procedure?
We've corrected Coke bottles. We have. We do.
Wow.
I'd say about 98% of our patients who have surgery, laser surgery, whether it's PRK or LASIK, whichever it is, wind up getting 20/20 vision without glasses afterwards. The other 2%, less than, maybe they get 20/30, 20/25, no wears glasses afterwards, at least for distance anyway.
Now, the patient you operated on today, Jenny Severino, for a cataract patient, she was 90 years of age, but you also have, you hold a certain title. Why don't you tell us a little bit about that? Operating on somebody maybe a little bit older.
Yeah, I'd say about 10 years ago, I operated on, at that time, which was the oldest person who's ever had cataract surgery, and he was 105. And you remind me of the fellow on I forget, Cal Burnett show. The 100-year-old man just walked a little bit. He's a great guy. He's telling about the Civil War. He did very well.
Now, we see a lot of the older patients obviously coming in and getting the cataract surgery. Right. Is there, do you see younger patients coming in and getting the laser surgery done or corrected it?
Laser surgery is, well, any age. We started off with people who are very young and like in their 20s, and that's for nearsightedness. The far-sighted people who are pretty now are older. These are all people in their 50s, 40s, 60s.
Is there anyone
we treat the whole range.
Is there anyone you recommend?
If they have some other eye disease, we wouldn't do it, yeah. But 99% of people who are wearing glasses for distance are treatable, are candidates, outside of people who have disease of their eyes.
Okay. Now, we have a phone number for the New Jersey Eye Center, and you do offer a free seminar. Why don't you tell us a little bit about that?
Yes. Well, we used to say that the seminar's purpose was that you'd have you come in, we'd briefly examine you so we could tell whether you're a candidate. But basically, everyone is, unless they have a disease. So, but what we do invite people to do is to call, ask for the seminar. They come in, I meet with them, we do a brief examination. We discuss the laser vision correction treatment, the pros, cons, and all that, and then I give them my recommendation. So it's very useful for patients.
So what's longer, the seminar or the surgery?
The seminar's far longer. The surgery you saw was like 2 minutes, whatever it was. The actual lasering was 24 seconds, I think, on a patient that we saw, right? 24 seconds.
That's amazing.
Yeah,
we sat there, watched the countdown backwards, and the next thing you know, surgery was over.
Look.
Now, the number, once again, it was on the screen, is 1-800-35-NJI. That's for the New Jersey Eye Center. And if you go there and you call, you can meet with Dr. Joseph Dello Russo. Doctor, thank you for joining us.
Thank you.